Welcome back. I hope the manufacturer's video was helpful for you to see that the Belmont is actually a pretty simple machine to use. Let's continue on to talk more about how we effectively initiate MTP. The first round of blood products will arrive automatically from the blood bank after the order for Initiate MTP has been placed in Epic and the code operator has been called to declare an MTP. The coolers are color-coded. They arrive as you see here in the picture. Red blood cells and plasma stay cool in the red cooler. Minimize opening and closing this cooler to keep the 6 products cold. Platelets and cryoprecipitate, if requested, stay at room temperature in the yellow coolers. You will use the MTP rounds worksheet to track the administration of blood products during the MTP protocol. The MTP rounds worksheet arrives in the cooler with round 1. This will help you track blood product administration. It also guides when you should be drawing labs to track how the patient is doing. You can see with the red circle that labs are indicated on the odd rounds beginning with round 3. Use the worksheet to tally intake totals and, based on the fibrinogen levels, consider requesting cryoprecipitate for subsequent rounds. The blood bank will automatically send round after round after round of blood products until we say stop MTP. Outside of the emergency department and the operating room, blood product pickup is primarily done by patient support services. To facilitate this, the unit where the MTP is taking place should prepare a number of blood product pickup slips ahead of time, also known as the red and white slips. Using the stickers with patient information, prepare a number of slips so that patient support services has these in their hand when they go to pick up subsequent rounds. The massive transfusion protocol is stopped once the patient has become stabilized or is transferred to definitive care, such as the operating room or the interventional radiology suite. In the event that the patient is transferred, all of the blood products that are delivered to the patient's bedside should be transferred with them if in the case that the MTP continues. One of the things that may be considered when stopping the MTP is whether or not hemostasis has been achieved based on lab values. It's very important to communicate that the massive transfusion protocol is being stopped. To do this, dial 111, the code operator, and advise that the MTP is being stopped and provide the name of the provider ordering stop MTP. After that's been done, use the MTP rounds worksheet to tally up the amount of blood product that has been infused and document this as one value in the Epic chart for the patient under intake. If possible, further break down the volume of the blood product administered as indicated here: 9 red blood cells, 8 plasma, 1 platelet. Upon completion of MTP, return any blood product and all of the paper transfusion slips with dual sign-off to the blood bank. Checklists are effective tools for improving patient safety in various clinical settings by strengthening compliance with guidelines, eliminating human variables, reducing the incidence of adverse events, and decreasing morbidity and mortality. Well-constructed checklists serve as cognitive guides for participants, ensure that all critical actions were taken, reduce variability between providers, and enhance coordination during high workload and stressful situations. I find checklists to be quite helpful, especially for low-frequency, high-acuity events such as massive transfusion protocol. I created a checklist that starts with the protocol initiating massive transfusion and guides the team through the protocol, including references for setting up the Belmont. Please look at the checklist and tell me if you think it might be helpful for you. Thank you so very much for participating in my nursing education capstone project. Please, please, please complete the post-test quiz so that I have some data to compare for my paper, and then the training session evaluation survey so that I can continue to improve my craft. Let me know when you're ready to get together and I will go over the machine with you, and I hope you have a great day. Thank you.